Namaskar, dear colleagues. I'm Dr. K. Agarwal, President, Heart Care Foundation of India, Group Editor-in-Chief, IJCP Group. Welcome to our webcast, where we are going to talk about understanding different systems of medicine, and we will answer queries of all our colleagues. Let us first understand, who am I? Am I my physical body? The answer is no. Then who am I? So I'm made up of 5 elements: air, fire, water, space, and earth. These are called gross elements. And these gross elements are made up of subtle elements called tanmatras, called qualia. They are called shabd, sparsh, roop, ras, and gandh. Now these tanmatras or qualia, along with my sensory organs and motor organs, they constitute the Sukshma body. They constitute the unseen body, mind, intellect, ego. And they in turn are attached to my consciousness. Vedic people call it as soul. In other words, if I want to divide my body, then I convert my matter and non-matter are attached to each other. So I say atom gets divided into subatomic particles, proton, electron, neutron, and they convert it into photon. At the level of photon, I am a wave-particle duality. I am a wave as well as a particle. At a wave-particle duality, I can be seen as a wave, therefore I am connected to the unmanifest part of my body. The science which deals with the 5 elements of the nature, air, space, fire, water, earth, is naturopathy. Water therapy, air therapy, sun therapy, absolutely no contraindication with modern system of medicine and can be combined together. These 5 elements in my body make 3 functions in my body: movement, metabolism, and structure. Ayurveda calls them as Vata, Pitta, Kapha. Homeopaths call it as psoriasis, syphilis, and psychosis. Doesn't matter for me if I want to balance my movement, metabolism, and structure. So therefore, this part of Ayurveda and this part of Unani and this part of homeopathy doesn't affect modern system of medicine, can be combined, can be worked together. Now these 3 functions in my body divides into 7 dhatus: rasa, rakta, mamsa, medha, asti, majja, shukra, which means plasma, blood, adipose tissue, muscle, adipose tissue, bone marrow, and immunity. The herbs which balances these 7 tissues are Ayurvedic drugs, Ayurvedic rasayans. They are also antioxidants in modern medicine. They can be combined together. Now when it comes to at the level of receptor, I can have a drug which is in the form of a matter, and I can also have a drug in the form of a non-matter. When I say non-matter, I convert matter into non-matter through nanotechnology. So nanotechnology in modern medicine is trying to convert matter towards non-matter, but yet it is a matter. But when I lose the matter, which is a conventional homeopathy and conventional bhasma therapy in Ayurveda, when I convert matter into non-matter, I don't have any substitute of it in modern system of medicine. When I talk about the Sukshma Sharir, I talk about control of the mind, intellect, and ego. Then I come back here and talk about psychology, cognitive behavior therapy. Psychologies are a part and parcel of modern medicine. And when I shift from sympathetic to parasympathetic state of mind to acquire a healing stage, I call it as pranayam, meditation, I call it as yoga therapy. When I do a yoga, I basically shift myself from sympathetic to parasympathetic lifestyle. We call them as progressive muscular relaxation. They call it as pranayam. We call it as a breathing awareness in the present. They call them as meditation. So there is a symbiosis in yoga and in modern medicine. So where is the confusion? The confusion comes in when I use homeopathic tinctures, when I use an Ayurvedic medicine, and I use a conventional modern medicine. What is the difference? Say, for example, if I take a salt, put that salt in alcohol, make an alcoholic extract, it becomes a alcoholic extract of XYZ called homeopathic tincture. If I take the same medicine and I start grinding it, make a powder and start grinding it, it becomes an Ayurvedic medicine. And when I take the same salt and take the ingredient out of it, purify it, it becomes a modern system of medicine. So practically modern system of medicine, Ayurvedic system of medicine, non-bhasm Ayurvedic system of medicine, and tincture homeopathy works in the same way. Then what about conventional homeopathy? If I start converting matter into non-matter, in the nanoparticle stage, it will be 1x, 2x, 3x, 6x. But a stage may come, I may not be able to identify and diagnose and detect that particular material. I say it has converted into a non-detectable, which is usually 6C or 6X. Then I say this is high potency homeopathic drug. Practically speaking, all these pathies are working in symbiosis with each other. They are working at different levels. Only when I'm using an Ayurvedic drug or a tincture, homeopathy, or a conventional modern system of medicine, I need to know what drug I'm dealing with. For example, crataegus in homeopathy has ACE inhibitor. Therefore, if I'm giving a ACE inhibitor, then I need to know that this homeopathic tincture also has a ACE inhibitor. I know cactus in homeopathy and in Ayurveda has an action like a beta blocker. I know chandam reduces heart rate. So I need to know about the herb, their actions, and I need to correlate it with a modern system of medicine. I'm sorry, I'm getting cough. Now I come back to understanding modern system of medicine. In modern system of medicine, I have two types of drugs, scheduled and unscheduled. Now scheduled drugs are H, H1 and X. Scheduled Ayurvedic drugs are Schedule E. Unless you are in Schedule H, H1, X and E, anybody can take those medicines because those medicines are available over the counter. We are now in process of arguing a case in Delhi High Court that why the government of India has not come out with a list of OTC drugs. Once that happens, all those drugs which are not in Schedule A automatically will come in OTC drugs. OTC drugs means no license is required to sell, no license is required to prescribe. Therefore, the term OTC drugs needs to be clarified, and it may get clarified by one of the cases which is going to happen as a PIL, where the court has taken its own motion and is discussing this particular type of a case. Now, Ayurvedic drugs comes under, they are not scheduled drugs. They don't come into Schedule H, X and X1. And if they don't come in H, H1 and X, that means they can be sold outside the chemist shop. And anything which can be sold outside the chemist shop, they can easily be prescribed by anybody. I got a question. Yes, E1. Yes, the schedule in Ayurveda is E1, and OTC means no prescription is required for selling. As on today, because Ayurvedic drugs are not scheduled drugs, they don't come into Schedule E1. That means they can be prescribed by anybody. There is no restriction. Similarly, all those drugs. Now, similarly, there is also a Schedule K in modern system of medicine under the Drug and Cosmetic Act, Section 23, under which government under the National Health Program can allow any drug to be prescribed by anybody. Now let's take some question answers. Modern system of medicine is comprehensive by itself. Should we need other system of medicine? So every system of medicine is working at a different level. We can't compare two systems of medicine. They are recognized systems of medicine. If they are recognized systems of medicine, they have their own plus points and minus points. Say, for example, for allergy, homeopathy may be good. For chronic diseases, some of the Ayurvedic herbs may be good. For example, if you talk about Google, it may be very good. Say we talk about Gambosia, we talk about obesity, many Ayurvedic preparations may be good from that particular angle, as long as we understand different systems of medicine. Can an allopathic doctor prescribe Ayurvedic medicine? Even no. So even category, even our scheduled category of Ayurvedic drugs, which can only be prescribed by an Ayurvedic doctor. All other medicines, the very fact nowhere it is written only on the prescription of an Ayurvedic doctor, they no more remain in a domain of Ayurveda. We haven't studied Ayurveda, and prescribing Ayurvedic medicine will it amount to quackery. It's a time for us to understand basic principles of. See, if you go to Chanakya Niti, if you go to Vidur Niti, they say always study our competitors. So we can't say to our patient, I don't know anything ABC about Ayurveda. No, we need to know. Because if the patient is taking some Ayurvedic medication, we at least should know the principles of Ayurveda. Now here, when it comes to understanding the principles of Ayurveda, suppose there is an Ayurvedic herb, find out its ingredient, go back to PubMed, and in Medline over PubMed, and write down that ingredient and see whether that drug has been studied the way modern medicine drugs have been studied. I'll take you an example of Lip52. Lip52 contains so many ingredients. Find out about each ingredient, read about it in the PubMed, and if it has been researched the modern medicine way, if modern doctors have researched, if they have written that this drug is hepatoprotective by this mechanism, then yes, there's no reason why can't you write, because you understand that this drug is going to interact with my other drugs or not. But for us, it will be something like a research drug. If you go back to the Supreme Court judgment of Poonam Verma case, where the Supreme Court clearly wrote that no drug can be written by a doctor unless he has studied that. So therefore, if you don't know ABC about an Ayurvedic drug or a herb, you can't write. But if you have evaluated that drug by going into internet through PubMed and you have studied its mechanism of action, you can talk to your Ayurvedic physician. And if you have a judgment by yourself that this drug is not going to affect or interact with my other drug, you can give that particular type of a drug. That's why. Whether any court ruling has gone against an allopathic doctor for recommending Ayurvedic, the answer is no. There is no such. There is a case of Poonam Verma where a case where a homeopath wrote an antibiotic. Yes, there is a case. Don't recall any case where an allopathic modern system of medicine doctor has written an Ayurvedic medicine. See, we write Ayurvedic medicine every day. We write Isabgol. Is Isabgol not an Ayurvedic medicine? So Isabgol, we write Panchamrit, we talk about many of the syrups are Ayurvedic drugs. So every kitchen as a pharmacy is basically an Ayurvedic in origin. We take Ayurveda every day. The whole kitchen, the whole masalas are basically from Ayurveda. So the answer is that we must evaluate the drug through PubMed. And if I find that, if I'm convinced, I don't think so, anybody can say why you are writing this particular drug. What is your opinion on the recent WhatsApp message from a state medical council that is being circulated? I don't care about what WhatsApp is going unless there is a direct notice to anybody. The message is very clear. The message is that we as doctors are scientists. We believe in data. For us, every drug is a drug. And if there is a data available on PubMed, which I can rely, which I can see that there is an authentic study, and in that authentic study, if I see that a particular herb is effective, it is not associated with other drugs. Suppose I find a drug, say for example, even fruits are drugs. So we know that many drugs don't interact with the grapes, and we don't have to take them. But yes, there are some precautions. Don't give any herbal medicine unless you know about it, unless you know the action, mechanism of action. If a herb has a proven mechanism of action And if it is written in the PubMed, we have studied, I don't find any reason why anybody can't write. That becomes my personal opinion. Some more questions we can take.
Combination of painkillers and multivitamin drugs rational.
Painkillers and multivitamin drugs rational, a combination of that. I think I'm basically a believer of giving medicines separately. If you are giving a painkiller, why do you need to give a multivitamin? You give it separately. If you're giving a multivitamin with a antibiotic, I can understand. But with painkiller, these are two independent things. Give them independently.
Is lift 52 safe in pregnancy?
Is the lift 52 safe in pregnancy? Again, from my point of view, yes. But again, if I want to be 100% sure, I'll go to PubMed, I'll put it down, I'll put down each ingredient of that in pregnancy, and if I find that there are studies done that it is safe, I will take it as safe. From my point of view, lift 52, we have not seen any case report that lift 52 caused any damage in the pregnancy.
Sir, I have a cardiac patient who is on ecosprin for the past 6 years following valve replacement. Can I advise the patient to stop taking ecosprin 24 hours pre and post extraction procedure, as I don't have a full-time cardiologist available in my.
So the question is that my patient is on ecosprin, which is aspirin, which is low-dose aspirin, and the patient on low-dose aspirin is going for a surgery. In today's date, we don't stop aspirin. Aspirin can continue unless there is a compelling reason to stop it. So in all such cases, we can continue aspirin unless the surgery is surgery of a prostate, the surgery is surgery of a brain, any tissue where you find that if there is a bleeding, the person may die. The intraocular surgery, only in these situations we stop it, otherwise we continue aspirin. We do stop other antiplatelet drugs. And also, remember, there are many herbal drugs which have antiplatelet action, and therefore we normally say stop all herbal drugs 4 to 4 if the patient is for an underlying surgery, specifically if the patient is on aspirin.
Medicine is a blind subject. Ayurveda is not above this conception. I want your comment on this.
Medicine is a blind subject.
Ayurveda is not above this conception.
No, Ayurveda, see, every science is a recognized system of medicine and they are safe. We need to have a faith. Ayurveda has its own philosophy. It comes from Ved. And when I go from Ved, it comes from Atharved. In Atharved, clearly everything is reasoned out. Ayurveda has their own ways of praman. Ayurveda has their own way of giving evidences. Ayurveda has their own system of evaluation. Therefore, we need to respect all of them. We, as loose-handedly, should not comment on other systems of medicine. Similarly, we do not we should not accept a criticism from other systems of medicine on us.
Without having any knowledge of Ayurvedic medicine, can allopathic doctors prescribe?
So without having any Ayurvedic knowledge, can I write? Yes, go back to PubMed, read about the ingredients, find out the mechanism, and if you are convinced, go ahead with it.
If we give Ayurvedic drugs,
it is something like eating plants. You don't eat any vegetable or plant without reading it on the Google whether it is going to harm you or whether it is not going to harm you. So if you're going to a jungle, you can't take any plant or any leaf unless you know about it and read about it.
Our State Medical Council is forcing us not to write Ayurvedic medicine. As we all know, in chronic cases, Ayurvedic medication is the best and safest.
So if a state medical council, any state medical council or medical council of India or anybody tells you do not write Ayurvedic medicines or other systems of medicine, then you can you can have a colleague of Ayurveda. Both of you can come back and sit together and make a protocol. And in that protocol, you can decide that these drugs can be combined, these drugs cannot be combined. And then you can take a consent. If a state medical council comes out with any regulation, but if you explain to the patient and the patient is ready to take Ayurvedic drug, there is no restriction, nobody can stop it.
What is the recent molecular treatment option for tuberculosis?
When it comes to tuberculosis, every system of medicine has only one treatment, and that is go back to the government instituted standard treatment guidelines for tuberculosis. Don't go into homeopathy, don't go into Ayurveda unless you want to add with the modern system of medicine. Don't play with TB.
An allopathic doctor can prescribe Ayurvedic medicine in his or her RX. Are there any limitations? And if there are, then what are the limitations?
Again, when we are writing, so most of the time when we write Ayurvedic medicine, for example, a patient has cough, cold, and we know that we don't want to give him antibiotic. In that situation, if you want to give what are the options available to you? You can give betadine oral gargle. That means you can do, or you normally try to give a Ayurvedic antibiotic, say for example, Cetrilin. And these are antiseptics, Ayurvedic antibiotics. You can give haldi, and that is also, you can give neem ka pani. These are all Ayurvedic. In any way, their antibiotics are not required. It may help in reducing antibiotic resistance. Of course, if the patient has staph septicemia, you're not going to write an Ayurvedic drug. If the patient has a pseudomonas, if the patient has a Klebsiella, there you are not going to use Ayurvedic drug. But yes, those situations where there is a mild infection, no systemic antibiotics are required. In that particular situations, you can use other systems of medicines with or without their help. If you are a believer in Ayurveda, you can have a Ayurvedic consultant on your panel who can come once in a week and you can decide your protocol.
If I am an allopathic doctor and I prescribe Ayurvedic drugs and something goes wrong, then what do we do?
No, Ayurvedic drugs are safe. I've never heard of a reaction to an Ayurvedic drug, but there are some, those drugs which are herbal toxic, they are not medicine. You can have a reaction to a Ayurvedic herb if you take it without supervision, and if you take it from the jungle, it can, but I don't think so. I have ever heard of any Ayurvedic preparation taking any side effects. Still, we need to go through and find it out. But yes, if you are taking Ayurvedic medicine, you are invariably telling the patient, I'm putting you an Ayurvedic drug, and the patient has a faith into it, therefore consent is available. As you take a consent of every drug, also explain to the patient about the Ayurvedic drug. You are not supposed to give one Dispirin without a consent. You are not even supposed to give a penicillin, even oral penicillin without a consent. Consent doesn't mean writing. It can be a verbal consent. It can be, you need to explain. So our job is to explain. If you are writing a Ayurvedic drug, you can't write it blindly. You need to tell the patient, this is a herbal medicine. This contains this compound. This action has like this. And I'm giving it because, say for example, in jaundice, I have no other option. I don't have, I give UDCA and I give Hepamers. I give all these drugs I give. They may not have a hepatoprotective action. Then I can say that at least in Ayurveda, my Ayurvedic colleague says that these particular drugs, which are OTC, have some hyperprotective action. No side effects are there. And if you want, I can put you on that. So there is no harm. And most of the people will not say no for such medicines which have no side effects. But I'm saying, never write a drug if you are not read about it. Always read about it through the PubMed, and that's the best source. Any internet, not Google, but a reliable platform you can use, and you will find most of the market preparations of Ayurvedic drugs have studied their medicine the modern medicine way.
Can we go to jail for writing Ayurvedic drugs?
Can we go to jail for writing a drug? The answer is no, because it is not, to go to jail, you have to 304 or 304A. In both the situation, either there has to be an intention to kill a person or harm a person, or there has to be a knowledge for that particular purpose. If you have explained to the patient, see, consent saves us from criminal negligence. Never give any medicine to the patient without explaining and without a assumed verbal consent. The consent has to be implied consent. So if you are writing something blindly, even even if you give a patient with CKD, if you give a painkiller, he can go into renal failure. That's wrong. So therefore, you need to know about the drug, what you are prescribing.
I got a circular a few days back that some Ayurvedic brands like Lip 52 and Cystone should not be prescribed. How can I believe in these products?
How can I believe in a drug like Cystone and a drug like Lip 52? Read about the PubMed, and if you find that PubMed convinces you that these drugs are safe, then nobody can stop you, and inform the patient while you are writing drugs which are from herbal drugs. Whenever you are writing a diet, you need to write a herbal drug. Now on the right side, when you prescribe RX, you write the scheduled drug, and on the left side, you put down advisory. You put down the drugs which are not under the scheduled drug. When you write a prescription, you know the differentiation. On the right side, scheduled drug. On the left side, unscheduled drug. So that you know, you tell the patient, these are unscheduled drugs. They are not, they are available anywhere in the country.
Can I prescribe Ayurvedic medicine in hepatitis B?
Can I prescribe Ayurvedic medicine in hepatitis B and C? Yes, there are trials available on PubMed on many compounds. Go and read about that compound and that compound may be available in an Ayurvedic drug, you can try that, but never stop the treatment of Hep B and Hep C just by saying that Ayurveda will cure them. So there are treatments available for Hep B. There are treatment available for Hep C. Hep C is now curable. Hep B, some will require treatment, some will not. So those who require treatment, that treatment can be super added with hepatoprotective drugs from other systems of medicine or hepatoprotective drugs from modern system of medicine, but never substitute them. Any other questions? So let me revise the whole thing together, that the various medicines act at different levels of our body. Yoga is very good. If you do yoga, it shifts you from sympathetic to parasympathetic mode. If you do meditation, relaxation, pranayam. So one is, if you want to start your inner pharmacy, stimulate your inner pharmacy, one answer is practice parasympathetic lifestyle, which can be parasympathetic breathing, parasympathetic relaxation, parasympathetic mode of talking, parasympathetic awareness, parasympathetic relaxation. That's one way that you cover yoga, you cover naturopathy. Number two is be with the nature, eat seasonal fruits and vegetables of that month, of that particular season, of that particular locality, and that's second. Third is, in modern system of medicine, is avoid as much as possible the wheat, the rice, and 80 days in a year, eat only millets, bajra, jowar, and ragi, and you will be able to avoid insulin resistance. That's the third thing. And fourth thing is that take your medicines only when they are a must. And when you are taking medicines, ask your doctor. And if you are a doctor, ask yourself that if I'm giving a medicine, how long, what dose, and can I give him a least protective and a least toxic drug, not protective, least toxic drug. Do I have an alternative in naturopathy? Do I have an alternative in other systems of medicine which are absolutely non-scheduled drugs? Ask yourself, is this unscheduled drug available? Its ingredients available for verification in PubMed? Have they been studied by modern system of medicine? Have they been studied by modern system of doctors? You will find many drugs being evaluated. Say, for example, Amrit Kalash has been evaluated by AIMS when they're talking about Amrit Kalash in chemotherapy given at two particular timings. So you may find a lot of Ayurvedic drugs research being done by ICMR, by other standard universities, including top colleges. And if you find that these have been evaluated by the modern system of medicine, I personally, in my personal opinion, feel is they can safely be given as in addition or as an alternative to modern system of medicine, provided I can convince myself. Thank you.